welcoming everyone. Thank you for joining us for the From Awareness to Empowerment, Navigating Mental Health with a Neurological Condition webinar with registered psychotherapist Kristen Drozda. Your hosts for this session are Hydrocephalus Canada and the Dystonia Medical Research Foundation Canada. The event is generously sponsored by Amici Catheters. My name is Shauna Bodway, and I am the Director of Programs and Information at Hydrocephalus Canada. I will be the moderator for today's session. For those in the session that are not familiar with hydrocephalus and spina bifida, I'm just going to give you a brief rundown of what they are. Both are neurological conditions. Hydrocephalus can develop at any time of life and occurs when there is a blockage of cerebrospinal fluid that cushions the brain and the spinal cord. The blockage causes pockets in the brain to swell. If left untreated, it can cause varying degrees of brain damage. Treatment is typically brain surgery to insert a shunt system that absorbs the excess fluid and redirects it to another part of the body to be reabsorbed. Spina bifida is a neural tube defect that develops when the neural tube is forming in babies. A portion of the neural tube does not develop or close properly, damaging nerves involved in the spinal cord. The impact on a person can range from mild to severe, partial or total paralysis below the damaged area, loss of sensation in the legs and feet, and challenges with bowel and bladder function, motor function, and learning challenges are common. Both conditions can have ongoing and secondary medical challenges. So I'd like to also introduce Arcana Castellino, who is the National Director of Dystonia Medical Research Foundation Canada, and is a partner organization in this presentation today. Arcana?
Thanks, Shauna, and hello, everybody. Thank you for joining us today. As Shauna said, I serve as the National Director for the DMRF Canada. We use the short term sometimes. I'd like to share a little bit about dystonia for everybody. It is a neurological disorder that affects the physical body. It causes the muscles to contract and spasm involuntarily, which can be painful. Well, research has demonstrated that individuals with dystonia are prone to certain mental health disorders, including anxiety and depression. Now, these can be as disabling or even more disabling as the involuntary movements and postures characteristics of dystonia. And that's one of the reasons why we put this webinar together, and I'm very pleased to be here with Shauna and Kristen to help our communities overcome these challenges. I'll hand it back to Shauna to take you over some housekeeping items.
Thank you, Arcana. Today's webinar will focus on understanding what mental health is, how pain and stress can influence your mental wellness, and tips on coping with the stress of chronic illness and strategies to manage anxiety and depression. Please note that the speaker is not recommending any specific course of treatment for dystonia, spina bifida, or hydrocephalus. Always speak with your doctor about any course of treatment to ensure it is right for you. And now to our presenter. Ms. Drozda is a registered psychotherapist, Canadian certified counselor, child and youth counselor, and is a perinatal mental health certified counselor. Having worked in the mental health field for over 10 years, Kristen has the privilege to specialize in working with our most vulnerable populations at the most vulnerable moments of life, including those who live with chronic pain. As a therapist who knows mental health, Kristen understands the influence of environmental or physical stressors and how they make things so much more difficult to manage. Managing mental health can be challenging in the best of circumstances. Kristen's goal is to help empower you to foster your mental health while feeling your best. Please welcome Kristen to our presentation.
Thanks, Shauna, and welcome everybody. I'm really looking forward to being here with you today. As Shauna said, we are going to talk about understanding diagnosis and symptoms and how that plays in with mental health, and the understanding of influence on stress and pain. The influence of stress on ourselves and our bodies and our systems can really contribute to the pain that we're experiencing. Hopefully by the end, we have a better understanding of mental health and what that means for you. And I'm really hoping the biggest takeaway is you leave today with some tools. How are you going to manage some of the stress, pain, or mental health symptoms that you might be living with? And hopefully you feel a little bit better equipped to manage some of the stress of life, of living with chronic pain, of living with a diagnosis when we're done today. So let's jump right into a diagnosis. Like, what is this and what does it mean for you? How do we make sense of these labels? And this could look like both any medical-based labels or mental health. So just to start, a very basic definition, what is a diagnosis? It's the art of or act of identifying a disease from its signs and symptoms. Essentially, it's just a label for a group of symptoms that people are experiencing. And what's really important is people are so much more complex than this one term, right? This one label that we're often given. So we really want to make sure that we understand our own diagnosis and what it means for you as an individual. Most diagnoses fall on a spectrum. So just because you are identified as having a diagnosis, it doesn't mean maybe all of the symptoms mean something to you, or maybe there's other symptoms. You're like, well, where do these apply? And I think we're going to get into that in terms of the mental health and how those things apply, or are they their own diagnosis? We really know that symptoms impact people differently, and that is in the severity or the intensity or the duration that you're living with those symptoms. And sometimes when we're given a diagnosis, it either feels really great or it doesn't feel right at all. So really quickly, before we jump into this a little bit more, I have a couple questions. Let's check in. Technology's finicky sometimes. So what we're going to do is we're going to try this poll. I'm hoping you can answer these questions and see how people are feeling about their diagnosis, or even any diagnosis you might have had in your life. Have you ever felt like your symptoms are different than maybe Google or a textbook? I guess I'll just check in. Is this showing up for everybody? I know I see it here.
It is for me.
Awesome. Okay. So have you ever felt like your symptoms are different? Have you ever had the experience where you feel like maybe your symptoms seem less severe or much more complicated than it reads on paper? Or is there something on the list you do not experience? Or are there things missing? So I'll give everyone a minute to kind of look these over and answer if you want to participate. Let's give maybe 10 more seconds if you want to participate in the poll, and then I'm going to stop it. All right. So what we're seeing in the results is majority of the people are saying, yeah, my experience is different from what I'm reading. And that, yes, it's also different in the fact that I feel less severe or more complicated than the diagnosis itself is indicating. And that more people feel like they're experiencing other symptoms, or that their diagnosis has symptoms that they're not experiencing. So why are we talking about this? Really, it's because we want to make sure that if we do have a diagnosis, that we are looking at it as our very own, and that people will interpret the idea of a diagnosis for different reasons. So for some people, a label can be really stifling. especially if you don't feel like it fits. And for other people, it's a really huge relief. Oh, okay, now I can like understand why I'm having these experiences, and kind of giving it a name can be really helpful. But what we want to make sure is that we know, just because it's a diagnosis, it doesn't mean your experience is the same as everyone else's experiences. And I am going to assume for many people that one of your experiences is some element of pain, and kind of that's why we're here, and one of the pieces we're really going to be talking to. And even in that, your experience of that is different from other people. And then we want to think of the idea of these labels can have implications on people's mental health all on its own. That idea, if this label is something surprising or something, maybe when you first are diagnosed, it's really hard to process or understand, then these things can start to impact our mental health and how we feel, who we are as people. And then that can contribute to, more prominently, feelings of anxiety or depression. And we want to, we want to talk about that. We want to make sure that having a label doesn't become something debilitating for people. Perhaps even a label can stop you from doing things that maybe you once did. I can't do that. I have, fill in the blank for any diagnosis or label you feel like has been put onto you. And once this cycle begins, it can be really, really difficult to get out of, and it can really just sweep us away into negative thinking. So let's talk a little bit about mental health, a little bit more about diagnosis, and what that's like living with potentially a mental health diagnosis as well as a medical diagnosis. And, having that understanding of, why are we labeling people at all? And really, in reality, it's it's in a way to organize people's experiences. It helps with treatment planning, and it gives people information about their experience. It also, in a way, can connect us to other people who live with shared experiences. So we have these great organizations out in our communities that bring together people who are sharing different but similar experiences, and that can be really normalizing and helpful for people. So when we start to think about mental health while living with a medical diagnosis, is the mental health symptoms, are they their own set of symptoms, or is it something completely separate? So I'm here to tell you that the mental health symptoms are their own set of symptoms. They can occur concurrently with other disorders, so at the same time, but they're very rarely actually part of a medical diagnosis. So what does that mean? That means that it is something completely in your control to manage, that it doesn't have to be lumped in with maybe something that has less outcomes or is less treatable. Mental health is very treatable and very manageable. And when we think of mental health, every single person has mental health, right? We all have thoughts and we all have feelings. That means we all have mental health, and it will fluctuate based on circumstances. And we want to think of mental health as this thing that's on a continuum from healthy. Some people have healthy mental health, and other people have more hindering or debilitating mental health. And then there's every little spot in between. Because it's such a spectrum, and because, it's going to exist no matter what, we know each individual person can take control and manage their mental health. That could look like individualized plans and interventions or seeking other help. But we really want to encourage that any mental health symptoms are their own set of symptoms and should be addressed as such. Dr. Elliot Crane is a doctor, and he he studies pain and works with chronic pain, and pain itself is a disease. And that he says now most of the time you think of pain as a symptom of a disease. And most of the time that's true. However, 10% of the time from people who are living with chronic pain, it can persist for months or years. And when that happens, it becomes its own disease. So now we can think also that chronic pain could be its own symptom, that no wonder people living with chronic pain are experiencing mental health challenges. So we have some of the basics out of the way in terms of a diagnosis and symptoms and how they all relate in terms of mental health. And I want to hope that from here at this point, you can walk away with, I don't know, I like to have little tidbits of information to make sure we highlight, is that any mental health symptoms that you are living with are completely manageable. And it doesn't have to be part of any other diagnosis necessarily, that it is treatable and you can kind of take control of that piece when there are probably other symptoms you're living with that are out of your control. So having that, you know, I'm hoping to empower people by the end of this, that you feel like there is something you can do, that really mental health is something that happens to you and it's not part of who you are. So with that, we'll jump right into the idea that it's not you, it's a series of things that are happening to you. So we're going to talk now about stress, about pain, and about mental health and how these things are kind of coming together. So I hope at least some of you are interested a little bit about science, because we're going to talk kind of in a biological way about how these things are contributing to mental health and how stress is also contributing to pain. So let's talk about stress. It's a word we use all the time, but I feel like sometimes it's one of those words that we use all the time, but we don't really define well. So a stressor is any event that happens in our life that causes stress. Normally, when we're talking about stress, we're always putting it in this category of this tone of it's something negative. It's this thing that's happening to me, and it's this thing that's out of my control or that is really difficult to manage. When we're talking about things that are really unpleasant and difficult and challenging, we're talking about distress. And this is often how we're defining stress and using the term. But I also want to just let you know and give stress, take a little of the bad rap away, is that everyone has an optimal level of stress that can be really positive, motivating, or helpful to us. So stress can be really positive as well. So we want to notice when there is stress that is motivating to us, because that can really help us to make change or to work towards things that we might have otherwise felt we couldn't do. So let's define stress in a little bit more specific way. And this is going to start to introduce this idea of science that I mentioned. So we often know stress as a mental state. It's this thing that happens in our lives, and it can be all encompassing. It can be something that really challenges us. It can change our emotional state or the way we're feeling. It can impede in our thinking. It can cause intrusive thinking. It can make our mood really low. This is often the stress that we know and we're talking about. So we want to look at stress as anything our brain perceives as a threat to us. And when that happens, our brain produces cortisol, which is the stress hormone in our body. And this means we might not actually know sometimes that we're even stressed, and our body is producing this stress hormone without us even being fully aware. What we know about cortisol is that it can take up to 50 minutes from its release to reach its full effect in our body. So think of a time, have you ever, I don't know, I always think of like slamming a door, like somebody in your family or home or a friend says something to you and like you go from 0 to 100 and maybe you like slam the door and you're like, wait, what just happened? Why did I do that? Or when the other person might kind of come up to you and they're telling you like, wow, that came out of nowhere. What it really probably was a response to something that happened maybe 45 minutes ago or almost an hour ago, because our level of cortisol had finally hit its maximum and we were really easily triggered. And that's where kind of that going from 0 to 100 can happen, where you're like, well, nothing was happening. Like we were just having dinner or having this pleasant conversation. And all of a sudden, things switched. It's because of some of the background things happening within our body that we're not even aware of. So when we're thinking about our stress response and we're thinking about why maybe we're behaving or why we're doing things in such a way, it can be a result of our biology that's happening behind the scenes. So when we're thinking of those things, we want to think a little bit wider. What changed my mood right now? Was it something right now? Was it something a little while ago that maybe I'm just being caught up with because that stress hormone is now at its full effect in my body? And stress has both physical and psychological components to it. And this is something that causes our emotions, our thoughts, our behaviors to be impacted. And when we have a stress response, it is something we require, like we're required to do something about. So internally, we're going to need to respond or adjust to try and balance back out how we're feeling. So we can't just live with constant cortisol arousal in our body. We have to do something. So sometimes that might look like, I don't know, a meltdown or having an argument or something to get that release. Sometimes it looks like withdrawing. And then ideally there would be that noticing and using coping strategies, which we will talk about some coping strategies as we go. So as I said before, not all stress is bad. Some stress will be really helpful to us. So when we're thinking, for example, of relationships, when we are in contact with other people, sometimes maybe our relationship or the value of that relationship could be motivating for us to make changes. So the stress of, I don't know, potential conflict with a loved one, or potentially maybe losing a loved one because of our behavior or thoughts or our mood, that could be helpful to us to want to make change. Stress also warns us of danger. That's really fundamentally the idea of it. Notice when I need to be on high alert, when I need to know that I might have to move quickly. It helps us to, well, survive. Elements of stress are for survival. And it can be unhelpful because it can lead to physical and psychological challenges. And that's where we are going to focus our attention in the next slide. So when I was talking about the brain and stress, parts of stress are stored in the brain in the same areas as our pain receptors. And this is where now these things come together. So just a very brief parts of the brain we'll go over. We have an amygdala, and our amygdala's responsibility is to send signals to activate our nervous system for fight or flight. And fight or flight is a very primitive response that we have for surviving. If there is a perception of threat in our environment, we're either going to run away and retreat from it, or we might fight. So an example is if you're ever, I don't know, potentially out for a walk, or maybe like it's nighttime and you're getting like a glass of water and then someone startles you from behind, and you are either going to kind of skirt away, jump away, so flight, or maybe you're like reactive and you like punch the person, fight. Because that is a very automatic and a very survival-based response, we don't have time to think it through. Our brain just goes straight into fight or flight, and it is activated by the stress of that moment. And that our amygdala is responsible for kind of taking care of that for us. And we need that, right? Otherwise, I don't think humans would have made it over all of these years. Then we have our autonomic nervous system. And this can cause spasms and other physiological changes in our body. So if we are stressed, this might, I don't know, in your experience, some common kind of responses to stress could be like feeling nauseous. Some people report like sweaty in your hands or feet. Others, the opposite, where they feel really cold in their hands. Your heart rate can change. Things like that happen when we are really stressed would be due to the autonomic nervous system. Then we have the cortex. Our cortex is essentially the higher part of our brain that is responsible for all of the cool things humans can do that a lot of other animals can't do. It helps us filter through emotional factors, and it helps us with logic and decision making and processing information and language and creativity, facts, all of those pieces, all of those things that make us specialized beings. And when stress is activated in a high amount, our cortex actually starts to shut down, because our body believes we need to depend on our fight or flight system to be able to survive. And that's when, for example, if you've ever been in a situation and it's like highly stressful, and you just feel like you can't think, or you look back later and you're like, wow, like that wasn't the right decision. Or you became extremely emotional but had a hard time regulating, it's because your brain didn't let you in those times. And then we have the dorsolateral prefrontal cortex. And this is a part of our cortex that is helpful for decreasing pain. Now, as I said, our cortex as a whole begins to shut down if we are experiencing high levels of stress. So living with constant pain, consistent pain, chronic pain, daily pain is a stressor, and it activates and perpetuates this cycle of fight or flight and this cycle of stress in our brain. And like I just said, if we're experiencing really high levels of stress, our cortex, which is responsible for decreasing our pain sensors, isn't working at its 100%. This then can contribute and influence feeling more pain. So stress and pain really work together, but against people. So when we're thinking of stress, absolutely, experiencing pain is a stress. But there's also so many other parts of life. And, you know, we experience stress if you're working, in your relationships. Sensations of sadness or anger are also considered stress. If you lived through childhood adversity, old historical stressors still play a role in adult life. Painful memories are stressors. Post-traumatic stress disorder is a stressor. Socializing or not socializing is a stressor. I mean, family, responsibilities, finances, just life. There's so many pieces of our life that are stressors and can cause all of those things to contribute and contribute and contribute on top of physical pain. There's probably a significant amount of stress flowing through bodies all the time. And this is how stress and pain really start to connect, is because our brain is perceiving stress on so many levels, and then so many parts of our body become impacted. So when we're thinking of the body, our brain is perceiving stress, but now our muscles, our blood flow, our nervous system, our heart, our gastrointestinal symptom is all of these things are now being influenced by the amount of stress that we have. So if we're thinking of pain and managing pain, all of these things would contribute to help manage pain, but are now being impacted negatively. So when this happens, you might feel pain could show up almost anywhere in your body. It might feel like tingling or numbness, like a burning sensation. Some people experience like IBS or bladder symptoms, incontinence, heart palpitations, rapid heart rate, headaches, and migraines. So these are the outcomes people are having and experiencing because of the overflow of stress going through their body and their system. So over time, your body and brain are continuing this cycle and this cycle through your nervous system. Our body, our brain is really cool. And sometimes it can just be unhelpful. It's actually going to learn this routine. So now, even if you're not feeling overly stressed, maybe you're feeling great for a little bit, your brain's going to be like, no, there's this cycle that we go through. And people might start to experience sensations of pain that aren't actually associated with pain receptors being triggered. So now people who are already living with actual pain receptors, neurological pain, like things that are happening, could also be having extra sensations of pain when those other things aren't being triggered. Then this becomes even more stressful because now you're experiencing higher levels of pain or longer durations of pain because your brain thinks it's doing you a favor. Then what happens? People start to become worried or fear the idea of experiencing pain. And then associating pain, we associate that with further or more significant health issues, which could be stressful. Like, why now am I experiencing pain like in my leg? I've never had that before, and I'm having like this tingling there. That could cause a significant amount of worry. This is where anxiety and depression can really start to show up. So stress and pain really go hand in hand. And we're going to talk about mental health. And then when I said we're going to talk about, coping with stress, this is really why we can reduce our pain that we are experiencing, physical pain, through managing our stress. So this is where mental health is going to start to play a role. So we're going to move into talking a little bit specifically about mental health and psychological disorders to give some background and context to that. And then we will move into what do you do about it? So what is mental health? Psychological disorders are patterns of behavior or mental processes that are connected with emotional distress or significant impairment in functioning. So one of the things that I think that is important to note is, as we're talking about anxiety and depression, we're going to focus on those because those are seen in highest comorbidity with people living with medical diagnosis. And we know that people with chronic pain are also experiencing higher levels of anxiety and depression. So we're really going to focus on those. But it's important to also note that levels of anxiety and depression are normal in everyone. It becomes a psychological concern or like an actual mental health disorder if it is starting to get in the way of day-to-day functioning for a duration of time. So depression, just to give a little bit of background of what these are, if you're not overly familiar, depression would be denoted with severe lack of energy, feeling down, lack of interest in activities or things that you used to really enjoy, a sense of hopelessness, thoughts of suicide or self-harming. And one major contributing factor for depression is illness or health issues. So we know one of the major contributing factors to people living with depression is actually having health issues. So it's no wonder that in that population, we're seeing such high levels of mental health concerns and challenges. And then when we're talking about anxiety, there's often a pairing of physical and psychological symptoms. The physical symptoms are an arousal of your nervous system. And as I had mentioned before, this is where you're getting maybe like an increased heart rate, stomach issues, people reporting really having to go to the washroom, shallow breathing, shakiness, tingling, either sweating a lot or feeling really cold in their hands and feet. And then the psychological components are the worry, the fear, the nervousness, or an inability to relax. Living with a mental health disorder concurrently with a health issue is an additional stressor, and it can increase the severity of the mental health that you are experiencing, as well as your level of pain being experienced. So people living with concurrent mental health and health issues often have more severe mental health. But going back to the beginning, mental health is treatable and it is manageable with, understanding and support. So who's at risk? What are some of the major risk factors to mental health challenges while living with chronic pain? So we know the journey of being diagnosed and the process of unknowns can be extremely stressful. Often people who are in the process of being diagnosed or living with health concerns, there's a lot of bouncing around from specialist to specialist or doctor to doctor, or one doctor doesn't know, so they have to send you somewhere else to another clinic, tons of wait lists. This unknowns, this experience for people is highly stressful. There's an element of social isolation. This is both could be chosen where people are withdrawing a little bit, but it could also look like being busy from all of the doctor's appointments, or just feeling unwell where you just can't make it out to social events. For some people, there are elements of embarrassment or shame that stops them from wanting to participate in things. And social isolation is a contributing factor to mental health challenges. A sense of hopelessness, depending on a diagnosis, where you are in your diagnosis. Some people just feel like there's no hope, or the idea of the changes that go along with a diagnosis can really leave a sense of hopelessness. A sense of hopelessness is a risk factor for depression. The idea of feeling dependent for help. Depending on your individual circumstances, you might need help in areas you never needed help before. And the idea of asking for help is really hard for us as people. And even if you have the greatest support system, asking for help and feeling dependent takes a sense of identity from us. and that can become a risk factor. And then there are people who are dependent for help and don't have a social network or a support network that they can even turn to, which can then increase a sense of hopelessness as well. A loss of identity. Elements of life often change when we are living with a diagnosis, with a health condition, with chronic pain, that there are some pieces of your life that change. And we overlook this, I think, in the system a lot, that we really, we are somebody who we are. We have hobbies and friends and things that we do and a lifestyle and a sense of who we are and how we label and identify ourselves. And sometimes when we are diagnosed with a health condition, then our identity changes. And this can go back to the idea of the diagnosis itself. Do we identify now with a diagnosis? Do we identify with the idea of maybe being sick or having a medical illness? And did we ever take the time to process and grieve the loss of parts of our identity that did have to change? Most people don't. And it's really an important process to notice those changes. And it's okay to be upset about them. And it's also okay to sometimes be upset about them and sometimes be okay with them. Our mental health is never going to be like fully stable. It's always going to fluctuate. And this loss of a sense of identity can be a huge stressor for a long time because it will ebb and flow. And that idea of some days your life's changed and you're okay with it. And other days, maybe it's a certain time of year or people are doing something you really used to enjoy and you feel like you can't do it, that those times become harder. And that sense of loss can show back up. I'm talking a little bit about the idea of like grieving the person almost, or the parts of us that we once were. And what we know about grief is it's a long-term ongoing process. So kind of embracing it a little bit can help reduce the stress, because often who we are does change. And it's not always negative changes, right? Sometimes there are great changes that happen. Maybe you meet new people, your best connections. There are elements of this identity shift that can be really great in life as well. But if we are like living with mental health, it's really hard to see those outcomes. People also worry about the idea of feeling pain, and this can be a huge stressor. And that idea of being out of control, that these things are out of your control, is a huge stressor. So what happens a lot of the time, we know these risk factors, and people know, when they don't feel their best, and that maybe their mood is really low or they're experiencing high levels of worry. But what we have seen is there's a pattern that even though most people living with a medical illness or chronic pain are probably in contact with doctors quite often those appointments are very much specific to physical symptoms and talking about physical symptoms. And a lot of the times we see that people aren't reporting some of the psychological symptoms that they're experiencing and how like life is mentally and emotionally for them. And by not sharing that with a care team, or your care team not asking and, kind of digging into those areas, it's leaving people untreated for mental health concerns. And this also starts to put people at a higher risk of having more severe mental health because it's being left untreated. because it's kind of being overlooked at times. And we really want to remember that those symptoms are their own set of symptoms. So we don't want to brush them under the rug or ignore them or just contribute them to the fact that you have another diagnosis. They need to be addressed on their own. So I think I have said so much stuff so far. I think we are now going to stop for a minute, and I'm going to, I think people have been asking questions. So I'm going to take a minute to stop flooding you guys with information and answer some questions before we move on to the next part. Shauna.
Thank you, Kristen. So we do have a couple of questions, and one was, is it possible to have bad days or anxiety or low mood because of our neurological condition without actually having depression or an anxiety disorder?
Yeah, that's a great question. So absolutely. And I would extend that to those things can happen just because we're people. So I kind of briefed anxiety and emotions are things, they're natural things that are happening. So every single person will experience some level of anxiety, for example, at some point of their life. So it makes complete sense that sometimes you're experiencing some anxiety or worry or fear, and it's not necessarily an actual mental health diagnosis. And we all live with feelings and emotions and, well, life. And sometimes we're just less motivated or more tired, or we don't feel like participating in things, or our mood is just really low, crying, things like that. Like, we are all entitled to have a full range of emotions, no matter what they are. So even the ones we would often people would label as negative, that absolutely you can experience a full range of emotions and not necessarily have a mental health disorder. So things like symptoms of anxiety will happen to everybody at times. And symptoms of, I guess, depression, like low mood or not feeling motivated, also happen to everybody at times. So it's, I think I had mentioned where we want to be concerned or really check in and follow up is this something happening quite consistently? And is it stopping me from living my life the way I want to? So is it prolonged? Is it happening like on regular basis? Can I not like shake those feelings? Then we really want to like look into it and explore that more. But if sometimes on and off you're having those experiences, then it is likely just quite normal to the fact that you're people.
Okay. Next question. Why is it that sometimes I am accepting of my condition and other times I wish I was quote unquote normal again?
I think that speaks to that sense of identity I was talking about, and, you know, just the label of normal and not feeling like you fit into that classification anymore would be something you would have to process and grieve those elements of, I guess, what you're defining as normal have changed. And like I said, identity will ebb and flow as well. Sometimes maybe because of maybe your stress levels are lower, or, you know, your mood is higher and you're like, I got this is fine, I can manage, and you're okay with it. And then maybe in times where you are experiencing more stress or symptoms of your health are kind of more out there and more cumbersome to you, you're like, oh, like I really miss, you know, what used to be, and I wish I didn't have to do this. So I think there's a lot of contributing factors that play into like why sometimes and why not others. That could be, you know, our mood, our thoughts that are happening at the time, what's going on in our environment and our life, and kind of knowing that it's really normal to have those back and forth experiences.
Okay, that was very helpful. Next question. How does a neurological condition affect one's ability to communicate with others and their mental health?
I guess that would depend on the neurological disability. If it is something that impairs communication, then, you know, the basic being able to share those things would be really difficult. As well, it's that idea that once we're kind of in the medical system and we have like a physical disability or a neurological disability, the focus is very much on the diagnosis. And we often will either underreport some of those other pieces, or they're not asked about very often. As well, there can be a sense with mental health of like embarrassment or shame, that idea that I should be able to manage this. You know, lots of people can. So is there a barrier to sharing, you know, the true experiences? And is that getting in the way of being able to communicate how someone is actually experiencing their mental health?
Okay. I think you've answered this question, but I'll just say it. And if you have, great. If not, maybe you can address it.
Sure.
How do you deal with anxiety of negative thoughts that come with disability or a chronic medical condition?
Negative. So I don't know that I spoke to this specifically, but so when we're thinking of negative thoughts, thoughts are thoughts, right? They're these things that happen to us all of the time. We're constantly having thoughts. When we're getting stuck in thoughts, when from like a mental health perspective, we're talking about thoughts, it's often those intrusive thoughts that show up, we can't get rid of, and they really impact our behavior, or they're impacting our feeling, like our mood. And there's different ways, I guess, in a treatment sense that we would address this. One would be labeling thoughts as thoughts. Thoughts only have as much power as we give them. And often, typically, we give them lots. If the thought is there, it must be true, and we kind of follow through with it. But we don't have to. I often think, or like share with people I'm working with, I think of thoughts in like balloons, like helium balloons. So they're like floating, and you have a pin, and you can decide at any time, this isn't helpful for me right now. And you pop it and you move on. You don't have to do anything about the thoughts that are showing up. So one way of starting to manage negative thoughts is identifying them as such, and identifying them as not helpful for you right now. And if it's not helpful, then we're going to pass on it and just let it go. When thoughts become really troublesome, it's because we're keeping them at the forefront of our mind. What we know about memory, if we're thinking of like thinking and thoughts, is we can only actually keep 7 pieces of information at the forefront of our mind at any one time. But if we're holding on to it, one, we're stuck on it and we can't let new things come in. But we also know the opposite. If we can let new things come in, that one will just naturally bump out. But then if we are staying stuck on it, then we're like rehearsing that thought. We're actually going to store it, and it's going to pop up more and more. So that idea of, you know, taking control of your thinking essentially and being like, yeah, no, on to the next, will help actually start to reduce the amount that thought shows up or similar thoughts show up.
That was a great analogy of bursting that bubble and just putting it aside. And Sarah in the comments said thoughts aren't facts. Great point. Thank you.
Great. Awesome. Yes, they're
And
just thoughts.
Yes. And the last question I have is, how do you deal with people that know you have limitations brought on by your condition, such as hydrocephalus, but they refuse to accept it and still want the same or more from you?
Oh, relationships. That would be, I think, speak to our relationships with people. I would say in managing people around us that expectations are difficult. Change is also difficult. And I would imagine for people more newer diagnosed with something, the change of that for like support people or people around you is probably difficult. But you as an individual, it would be about boundaries and, you know, really feeling confident in who you are, what you can and can't do, and having those boundaries with people around us, which is super difficult. Putting in boundaries with family members, like, I appreciate that what I'm saying is definitely easier said than done, but it is definitely a boundary kind of conversation. And for people, you know, it's unfortunate, some people are really close to us and they just might not understand. And it's, how can we respond to that without trying to force people to change? Because unfortunately, the only thing we have control over is ourselves. And we can, you know, choose maybe not to engage them the same amount, or potentially like have them like try not to like request things from them if you know that their response isn't going to be helpful to you, pieces like that. But it's a tricky situation for people. But, you know, I guess in a really simple way of putting it is, we teach people how to treat us. And that could look like a learning curve for the people around you in terms of what you can and can't do at this point. And that the way they feel about it isn't your responsibility, right? You're not responsible to make them okay with the fact that you might have limitations now. That's kind of their issue to process and deal with.
That's a great comment. I can appreciate that. So we're at 2:00, and I know that we have lots still to go through for coping.
Right.
So
Yeah.
we'll let you get back to it.
Okay. So the part I'm hoping, I guess, people are most looking forward to is, what do you do now? Coping. I've talked a lot about stress. I've talked a lot about how it impacts our mental health, how it contributes to pain, but now what? So self-care. Let's talk about self-care. It's a word I'm going to say most of you have heard at this point. I'm pretty sure it's almost trending right now out in the world, but there's good reason for it. We need to take care of ourselves. And there is significant amounts of evidence that this can make a difference in our life. So in terms of our stress, our pain management, emotional well-being, and mental health. So we want to really try and do things that are just for us. So how do we practice self-care? You can feel emotionally and physically better if you can discover or rediscover things that make you feel good and something that's meaningful for you. And I want to just kind of side note, when we're talking about self-care, or when it is trending in the world, I notice it's like a thing people have to do. So the way I'm talking about self-care is, I'm not telling you to add things to your plate necessarily. If there's something really enjoyable that you can add that makes you feel good, that's great. And we can also practice self-care by just being intentional about the things we're already doing. So if any of you are like me, I like a coffee in the morning. And no matter what my morning is like, I'm pretty much having it. But there are most mornings, I have a young child here, and most mornings you're kind of sipping it as fast as you can, putting it down, running here, running there. You might be off to do something, rushing. You're doing it because you need the caffeine. But if you could turn this into a self-care thing, maybe there's 5 minutes you could sit by yourself and actually appreciate the taste of your coffee. And I don't know, I want to say texture, but like, is it a smooth coffee? Is it a bold coffee? Can you feel like the warmth of the mug that you're holding it in? If you can drink your coffee that way, even for a few minutes, that is practicing self-care, because you are doing something intentionally just for you. So self-care can be this thing that we do, that we add. Some people like going out for walks. Some people like socializing. Some people, I don't know, take baths or long walks on the beach, you know, whatever those things are. If you can do them, great. And if you're busy, because life is busy and sometimes hard enough, can you just do the things you're already doing and do them with intention that it's for you. Another great example to do this is like a shower or a bath. Most people at some point are doing basic hygiene. Can you like really relish in the smell of your shampoo, or, you know, notice how your skin feels afterwards? Things like that are self-care. And we know every tiny bit counts. So it doesn't, like I said, have to be this big, profound hour-long thing that you're doing and scheduling every day. If that works for you, great. And if that doesn't, then any tiny thing that you can add in or do intentionally will make an impact. Practicing self-care is also an element of staying socially engaged. Social isolation can worsen depression and chronic pain. So if there's any level of socialization that you can participate in, then that is also considered self-care. And if you do have limitations for things that you used to value the most, or activities that were really meaningful to you, and you can't do them the same, is there a way to adapt it, to find a way to enjoy that thing again? And that, you know, that can help also with that sense of identity loss and help bridge that gap. Things like meditation and deep breathing are really helpful. We're going to talk a little bit about deep breathing strategies in a minute. Eating healthy, relatively healthy, things that are more anti-inflammatory can help with reducing our stress as well then as pain. We know like highly sugary, highly processed food can contribute to mental health, pain, inflammation. So, you know, eating as balanced as we possibly can is also self-care. Any movement you can do, low impact, any type of physical activity actually helps boost endorphins and relieve pain, restore muscle tone, and increase our sense of well-being. And adequate sleep. I'm sure most people have heard that sleep is a really healthy thing to do and helps with our health. It also helps with our mental health. And it can help with our brain getting that rest to modulate and restore centers that we need to help with pain management. Something I wanted to do today is pulling from EMDR, and it's eye movement desensitization and reprocessing. And I know it's a long word, but what we know from EMDR is the mind can heal itself. And we know mental health, we know stress, pain, all of those things are really coming from our brain, right? Whether it's pain messages going to other parts of our body, whether it's our mental health, our mood, all of those pieces. So we can manage information in a different way. And EMDR helps create connections in our brain's memory. So what I was hoping is we can kind of stop this really quickly is doing a quick activity of EMDR. And it's a really simple coping strategy, relaxation technique. So I'm going to walk you through it, and we'll just spend a couple of minutes doing this, and then hopefully it's helpful for you. So it's called a butterfly hug. And what you're going to do is you are going to take your hands, if you can, and cross them and link your fingers. And if you can put them just over your chest, kind of under your clavicle. If this is not accessible to you, you can put your hands on one arm or the other, on one leg and the other, as long as you are touching the left side of your body and the right side of your body. If you are able to join me in doing butterfly hugs, this can be a really calming strategy that can help release stress, which then we know can help with overall wellness and help with some pain that people are experiencing. What a butterfly hug is what you're going to do is just slowly at a rhythm that feels good to you. alternate the movement of your hands, kind of like the way a butterfly would flap its wings. And as you're doing it, I just want you to breathe really slowly. Try and breathe as deeply as you can. So pulling the air all the way down into your belly. While you're doing that, find a rhythm that works with the tapping sensation. And just notice your body and notice what's going on in your body. And what's going around your body. Are there physical sensations? Are there things outside of my voice that you can hear? Is there something you are looking at? Something you smell? Are there thoughts popping up that you're letting just pass by like clouds? And just take a minute to notice everything that's happening. And I challenge you to do this while not judging any of it or holding on to any of it. For some people, it's helpful to imagine that all of these things are like clouds and you're just watching them pass in the sky. If it's helpful, close your eyes and just notice anything that is uncomfortable, anything that maybe you feel tightness, tingling, numbness, any thoughts that you're having that aren't helpful right now. Just notice them floating away like clouds. Try and imagine them floating away like clouds. I'm going to give people a minute to continue without me talking. When you're ready, I want you to imagine that there's a healing light. So a light that's coming from the sky right through the top of your head and streaming down through your body. It's a soothing light, a calming light, and it's just resonating through every cell of your body. I want you to notice what color this healing light would be for you. Imagine this light is coming down through your head, your neck, through your arms, down your torso, down your legs, to your feet, and straight back out into the ground. This light is continuous and it's resonating through every part of your body, soothing and calming. Now notice any disturbance or discomfort that you have left in your body. Does it have a shape, a color, a size? I want you to notice the light directing itself to each area of disturbance you're experiencing. Notice the lights going around it and through those areas of discomfort. Notice that as the light is resonating around those areas, it's pulling the discomfort through your body, down, out of your feet, and into the ground. Remembering this light is never ending, healing and soothing, and it's pulling every area of discomfort down, out, through intense healing. And it's going through your body and into the ground. So notice this light, this healing and soothing light, pulling all of the discomfort, stress, down, out of your body. And when you're ready, you can just take a deep breath. You can stop the tapping. So we started with butterfly hugs and we did the light stream. And these are elements of EMDR, but they are elements of the EMDR protocols for chronic pain. And people have been studied, EMDR has been around for decades, and there's a lot of research having been done and currently being done on the effectiveness of these techniques plus other elements of EMDR kind of coming together to support people in a treatment way for chronic pain. So I'm hoping that you're able to now take this and use the butterfly hugs and the imagery of the light stream to help with some calming and relaxing in your lives after we are done here. Kind of moving on, and we kind of did a little bit of mindfulness, but mindfulness is another great strategy for coping with stress. It can be both calming and energizing, and it can help from mental health to physical ailments in people. We also know gratitude supports overall well-being and reduces symptoms for anxiety and depression. In the handout, there are kind of like how to practice mindfulness and how to practice gratitude. So I'm going to just, in the interest of time, skip over these slides because they're available for you. And I want to just spend a minute talking about breathing, because there's two ways we can use breathing and deep breaths. One for anxious feelings in a really calming and a relaxing way. And then there's one for low or unmotivated mood that can be really stimulating. So I want to spend a few minutes kind of going over these tools depending on what your experiences are in the moment. And like I said, people fluctuate and experience levels of anxiety or symptoms of depression just kind of day to day without them being actual mental health concerns. And these can be really helpful coping strategies for that. So when we're using a relaxing breath, this is essentially a natural tranquilizer for our nervous system. And we know when we're anxious, it's because our nervous system is overstimulated. And we really need to practice this to make it as effective as possible. So you are going to be breathing. And when you breathe in, you're going to do it on a count of 4 seconds. Then you're going to try and hold your breath for upwards of 7 seconds. And then you're going to exhale completely for a little bit more than your hold. So I put 8 seconds. If you can only hold your breath for 5 seconds, then exhale for about 6. Just make sure your exhale is the longest part. And when you are exhaling, exhale everything completely. So you should hear a like blowing sound coming. And that means you're really like pushing air out. That is the calming piece of the full breath. And you want to do this about 4 times to start with and start practicing it. What a lot of people, when I do this in my practice, notice is if you're practicing it and you're not overly stressed or anxious, it can make you a little bit lightheaded. So that's why it says like start low, just do it a couple times and practice that a bunch, and then work your way up to doing a longer set of these breaths. And they can be extremely calming and relaxing. It can help reduce anxious feelings and thoughts. And it can also slow down any physiological symptoms that you are having because of stress or anxiety in the moment. So you would breathe in, you would hold, and then a slow, full release. So that is if you're feeling really stressed or anxious. Now, we can also do a stimulating breath if you're really feeling low or unmotivated. And this kind of is pulled from yoga. And the idea is to energize and increase our alertness. And this can help us kind of feel like a little bit of like get up and go. So we would do this breathing through our nose if we can. And we want to make them as short as possible, but equal. And the idea is that our diaphragm is going to be moving really quickly. So if you want to take a minute and try, if you're not feeling anxious or something right now, taking a minute and trying it, and you're just, and this breath can stimulate us and help energize us to, I don't know, maybe do something or just change our mood and shift the like energy going through our body. And we want to do this a couple times. So we want to cycle through doing the really rapid breaths for maybe, again, I would start lower, maybe 10 seconds, and then do a few regular breaths, and then do another 10 seconds and a few regular breaths. And this can help kind of uplift us and energize us to do, you know, something, anything that we need to do, or maybe we're just kind of feeling sad or low and we just want a little oomph in our day. We would use this stimulating breath. Guided imagery is another element of mindfulness that can be really helpful and effective. This is a YouTube video. The link is here in the slides, which I think you guys will also have access to as well. This is specific to a guided imagery for pain. So if you want to try this at some time, it kind of walks you, you just play the video and you'd close your eyes and just follow through. But it can help reduce cortisol in our bodies. So guided imagery is another really helpful strategy for when we're feeling a high amount of stress. And as I said, gratitude, this is on the handout, but when we want to practice gratitude, it's very much noticing all of the things we overlook. We overlook things really quickly and focus on challenges. And it can be really profound to just notice a couple simple things in your life every day that can help you feel like there is life worth living and that you do have a lot there, even in the adversity of the other elements of life.
Hi, Kristen. Just going to jump in. We've got 8 minutes left.
Yep.
So that was so amazing. And I know that Archana and Sean have questions.
Mm-hmm. Thanks, Andrea, and thank you so much, Kristen. That was a very informative webinar, I must say. Knowledge is always power, and understanding what influences mental health is key to dealing with it or coping with it. So thank you so much. I have some questions pertaining to coping. So I'm going to start asking. One question we had was it's pertaining to waiting for treatments. Unfortunately, most patients, I guess, with neurological conditions they have to wait for long periods of time for especially surgeries. And a person asks, how can I cope mentally when my quality of life is being delayed while being on a wait list?
Wait lists are a stressor, right? There's no question, especially, the last few years when surgeries and, access to support and medical resources have been, canceled and delayed. And, any of these coping strategies can be really helpful because, you're dealing with stress, the stress of not knowing. I imagine there's elements of anxiousness, like what's going to happen between now and 1 year, or how could things get worse? And, treating it almost like symptoms of anxiety, and how can you manage those thoughts and coping with the reality of the wait? Like, is there anything you can do? What is in your control while you're waiting? And by giving us a sense of control, it can reduce the stress of the wait. So for this individual circumstance, I don't know, what things they do have control over, but really focusing attention on what pieces you do have control over. So you do have control over, managing your elements of stress. You do have control over, like, if it is really impeding your mental health, there is probably quicker services for that, and ways to get treatment for those elements while waiting for the pieces that really are out of your control, which would be a surgery date.
Thanks for answering that. And this is a common question, I guess, in both communities. That's Hydrocephalus, Bifida, and Dystonia communities.
Sure.
So another question I have, this is asked by someone who has lived with this chronic condition for over 30 years. And they've said that they've been beginning to experience more anxiety, or so their family tells them, and random bouts of depression. It puzzles them as they were never prone to this before. Can it be attributed to changes in hormonal levels or something?
Yes, it could be. That could be a contributing factor. I would wonder if, like, the perception of maybe getting older, or the idea of having lived with this for 30 years and what that means at this point of your life, is probably a bigger stressor. But yes, definitely anything biological can impact our mental health, because our brain does everything. And when hormones change, other elements have to change as well. That would be, if there is concern that it's a hormonal thing, that would be something for sure worth asking your doctor about. But it could also be, just circumstance at this point of life, coming from the mental health side. COVID in the last few years, like, nothing's been the same for people, and kind of everything's been more heightened in stress. And it could also be, other factors as well. I always say people are super complex, and there's probably never one actual answer. There's probably like a bunch of variables that come together and, have this outcome.
Thank you. Thanks for that. It's very important to know, I must say. I believe you've answered some of this, but it's a person asks, how do you deal with anxiety or negative thoughts that come with the disability?
So
is there something in your tip sheet that you haven't covered about dealing with anxiety or negative thoughts that come with living with a disability?
I think you would I think I spoke to like thoughts and managing thoughts when we broke before. So the same kind of context in terms of thoughts is really taking power back from them. Just because they're there, you don't have to do anything about them, or you don't have to have the feeling you think is associated with them, and really starting to challenge the thought that it's, you know, not helpful right now to have that thought. And then there are ways, like from the mental health perspective, things like cognitive behavior therapy is helpful in terms of like actively challenging the way we think, to not let ourselves get caught in like cycles of traps, because we do that really easily. And how can we, you know, see things from a stance of like what really is factual and reality based? So maybe even shifting our thinking to say, like, is this a realistic thought? Is there evidence to prove that this thought really is true? Because otherwise it's just an opinion, and well, we know opinions are only as much as we give them power, right?
Interesting. Yes, certainly. I guess there's a follow-up question similar to that, is the embarrassment faced by people, people's view of, you know, when you are living with a disability. Somebody said that they're concerned about what people view, they're talked about overcoming what people may be thinking about visible tremors or disabilities. So you recommend always going to controlling those thoughts and perhaps using your tip sheet.
Definitely. And, you know, the piece of other people's opinions is really none of our business, I guess, in a light way of saying it. You know, the harsh reality is we can't control what other people think, and we shouldn't have to explain ourselves to other people. And we can become confident in who we are, no matter what that looks like. And kind of too bad for other people if they don't understand, which is normally where judgment comes from, right? A lack of understanding. Unfortunate, but
it's challenging, certainly.
For sure.
Thank you. Shauna, I wanted to ask you, do you have any other questions to ask Kristen?
I think there's just one here. How do people with chronic pain or with a chronic condition cope with the limitations themselves that those conditions have brought on to them?
I think that would be kind of that grief and loss piece I spoke a little bit about, you know, the limitations, like what is it stopping you from doing? And by going through that process kind of moves us into an area of acceptance. And then that shift to acceptance can then open our viewpoint to, you know, okay, I might have lost this, but what did I gain? But going from like diagnosis and loss to gain isn't not a straight line, that there's going to be ebb and flow into how we feel about that. And, you know, giving yourself permission to miss the pieces that are no longer, while balancing at the same time an appreciation for what you do have.
I love that. that was a great comment. So I think we're at 2:30, so I think we'll end it here for today. Thank you again so much. This was so informative, and the exercises were great. I was getting right into the butterfly, and I had to consciously, you know, move myself out of it so I could monitor the chat. So Kristen is willing to answer questions that didn't get answered today. So you can email them to info@hydrocephalus.ca today, and we'll try and get those back to you by Friday or early next week. Arcana, do you have an email that you would like people to email to as well?
I think it's fine to email hydrocephalus.ca, and Andrea can perhaps forward that to Kristen. And I just wanted to point out that these will be shared as anonymous questions.
Yes.
And we will get back to the individuals.
Yes.
Thank you.
All anonymous. And thank you very much again. Wow. I'm just trying to absorb everything that you said today. So it was definitely a great session, and hope everyone on the session enjoyed it as much as we did. Thanks very much, Kristen.
Thank you so much.
Have a good afternoon, everyone.
You too. Bye, guys.
Thanks, everyone.
Bye.
Bye-bye.